Well, let's talk about erector spinae plane blocks. Patients are grateful to have these done. Let's cover the steps involved in the block. First, we've got to order the ultrasound in Epic and sign the order. Next, we go to the machine, go through the steps of placing the patient's information into the ultrasound machine itself. We assemble equipment for the block. Here's a list of the necessary items. The needle we use for this is a regular BD 22 gauge. However, to take the safety away and make the needle longer, which looks like this, I take a pair of trauma shears and cut off the hinge on the side of the needle so that the protector comes off and makes the needle about 1/2 inch longer. The control top syringe is used so you can aspirate and inject for safety reasons. Medications. First, we're going to use dexamethasone or ropivacaine. We're going to order the Decadron in Epic, the intent being it's given to the physician. And then we're going to order ropivacaine again. This will be given to the physician. Moving on to the patient, we're going to mark an X on the proper side, both anterior and posterior on the patient, with an X with a marker. We want the patient to be prone. This is very important when you're learning the procedure. Final steps in the setup. I use a double glove setup, and by this I mean I put on the size sterile gloves I wear and then a half size bigger. I do this on all my procedures. The reason being, if I have 2 sets of gloves on, I can use the outer glove in a non-sterile fashion. And just at the right moment, I can doff my outer gloves and have sterile inner gloves to complete the procedure. I've done this for a number of years, works very well. You don't have to do it, but I've always found it to be very helpful and allows you to have sterile hands very quickly when you need them. Alright, now my sterile gloves are on. The outer set can be used non-sterilely to drop the medications. I'm going to drop 1 cc of Decadron into the syringe. And after I have that 1 cc of Decadron, which is 10 milligrams, I'm going to fill the remainder of that syringe with my ropivacaine. The control top 10 cc syringe will hold about 12 cc's total, therefore I have 11 cc's of 0.5% ropivacaine or 55 milligrams of ropivacaine in the syringe. Take off the drawing needle and replace it with the injecting needle. So the patient is prone. We're going to use non-sterile gel to look at the lungs and the ribs, with the final goal being to locate the transverse process of T5 on the affected side. Once we find this, we're going to wipe off the probe with the germicidal wipes. Now I'm going to doff my outer gloves, and once these gloves are doffed without contaminating myself, I can now continue on sterilely or aseptically with my gloves. Now placing the probe cover on the transducer using the bedside stand, a little bit of gel into the tip of the transducer. Now place this on the transducer without contaminating yourself. And next, the elastic rubber bands are placed to cover the tip of the transducer with no air. And then finally, a little bit of gel is added to the transducer. Next area is prepped, and we find the transverse process of T5 again. So now we prep the patient and now relocate our T5 level on the affected side. So notice I'm standing at the head of the bed, facing the foot of the bed, also known as cranial caudal. A number of reasons you want to learn in this manner. Most of them have to do with safety for you and the patient. Once you learn how to do the block, you can do it in any position you wish. The patient can be in any position you wish, and yourself as well. But while learning the block, cranial caudal is the safest way for you and the patient to learn this block. We're going to start the injection, and we're going to take images of the needle. We're going to aspirate and inject. We completed the procedure. Now we're going to press in exam to transfer the images to PACS. We're going to place the procedure note of the EMR. Here's an example of a procedure note. Notice at the bottom it says comments rectospinal plane rib block. It says nerve block at the top. Now we're going to re-evaluate the patient. We plans on discharging the patient home. Some final notes. If you're credentialed to do a FIC-NV block, you can do this block at Harris. No monitoring is required due to the low volume of the injectate. No chest X-ray required after the procedure. Note that patients with rib fractures have the worst pain on day 3. Due to the steroid in these blocks, these help for a number of days. Stating rectospinal plane block in comments helps with the coding. Note elderly patients with multiple rib fractures are a very delicate group. Most do well, some do not do well and need close follow-up. These patients are very grateful and some of the most grateful patients you'll ever care for. Thanks.